Hi there, I'm Dr. Shariful and today I'll show you how to examine the respiratory system. So let's start with our patient. Assalamu alaikum. I'm Dr. Shariful কেমন আছেন আপনি? আমি আপনার একটু বুকটা পরীক্ষা করব আপনার ফুসফুসগুলো দেখব ঠিক আছে Okay? So we have taken the consent and also introduced ourselves. Let's proceed. The first thing you have to know that what are the things we're going to see in a patient in respiratory system examination. So there are actually 4 parts of examination. We have to see, which is inflection. We have to feel, which is palpation. We have to percuss, and then we have to hear, which is auscultation. See, feel, percuss, and auscultate. So when we want to examine, we have first the inspection. And on inspection, the most important things to note are, first of all, you have to see the respiratory rate. And to count the respiratory rate, we can actually step below. At the level of the patient, and actually we can measure the respiratory rate. Then we also want to see if there is any deformity in the chest wall, and the most common deformity that we want to see is any problems that are associated with COPD, which is also called a barrel chest. So the chest actually becomes a cylindrical structure rather than a flat structure. And we can also look for other deformities size such as hair loss or any scars, any engorged veins. Okay, so those are not that important. Those are the major parts of the infection. Next we will go to the palpation. And on palpation we have actually 4 things to see. First we will see the position of the trachea. Next we will look for the position of the apex beat. Next we will proceed to see for vocal fremitus. And ultimately we will see the expansibility of the chest. So let's see them. So you can see I'm putting my 2 fingers over the sternoclavicular joints. So those are the 2 sternoclavicular joints, and then I'm pushing my middle finger in between the trachea and the sternocleidomastoid muscle. So this is trachea, this is sternocleidomastoid muscle, and I'm pushing my fingers in between those. I'm actually assessing the space between those 2 structures, and I'll do for left side and now for right side. So if there is any discrepancy between 2 sides, it will tell me that the trachea is shifted. And as you know, there are many causes, but the most common cause of shifting of trachea in the same side will be collapse or fibrosis. Okay, the most common causes. And most common cause of shifting of trachea to the opposite side will be fluid in the pleural cavity, which is pleural effusion, and pneumothorax. Okay, so let's move on to the next part of the palpation, which is palpation of the apex beat. So we have to put our hands over the patient's chest. Suppose we got the apex beat, and now we have to measure the location from sternal angle or angle of Lewis. This is the second intercostal space, third, fourth, fifth, and I have found it here. So it's in the 5th intercostal space, and just lateral to the midclavicular line. So it's okay. You can also actually measure the distance, but it's not essential to do. Next, we have to see for vocal fremitus, and now we have to tell the patient to say some words with N. আপনার এখানে যখন হাত রাখবো তখন আপনি বলবেন 9 অথবা ঠিক আছে 9 বলবেন, না ভালো হলো 3 সো 3 বলবেন 3 বলেন
3
ভেরি গুড বলেন
3
আবার
3
আবার
3
আবার
3
সুন্দর বলেন
3
বলেন
3
আবার
3
so we are comparing the both sides
3
now next I want to see the same thing in the lateral aspect or the axillary aspect. So আপনার হাতটাকে এরকম করেন, হ্যাঁ ভেরি গুড, নিচের দিকে রাখেন এভাবে করে। আবার বলেন 3 আবার বলেন
3
আবার
3
আবার
3
আবার
3
আবার
3
আবার
3
very good, সুন্দর. Next we have to see the expansibility, and we have to see the expansibility which is localized or which is generalized expansibility. So we have to see expansibility in 3 locations. We start with upper part, next middle, and the lower part. ঠিক আছে? আমি যখন এখানে হাত রাখবো তখন মাথাটা একটু ওইদিকে ঘুরে লম্বা করে শ্বাস নেবেন, বুক ভরে শ্বাস নেবেন, ঠিক আছে? So we have to fix our hands and keep our thumbs close together. ওইদিকে মাথা ফিরান, লম্বা করে শ্বাস নেন, আবার শ্বাস নেন। So you see the fingers are moving outwards. Next, লম্বা করে শ্বাস নেন। He has nice chest stability. আবার, very good. Next, lower part. Very good. So we have seen the expansibility, and we can also measure the total expansibility, which is not essential. So those are the parts of the palpation. So position of the trachea, position of the apex pit, vocal premitus, and expansibility. Now we proceed to the percussion. So for percussion, we start with the apex. So to look the apical percussion, we have to put our middle finger in the apical area and strike with the middle finger of the another hand. Okay, like this. Okay, next we will see all the areas. Here we have found the upper border of the liver tunnels. So this is so we have to measure the upper border of the liver tunnels. Then we have to do the auscultation, which is we have to see the breath sounds in the apical region. So শ্বাস নেন লম্বা করে, শ্বাস শ্বাস টেক, then শ্বাস শ্বাস, and we will do this for all and also the lateral side. Next we have to ask the patient to say 3-3 or 3-3 and do the same areas of percussion and look for vocal resonance. Okay, so this will be the percussion. So here, 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 and we'll ask the patient to say 3-3, 3-3, 3-3, 3-3, and same. Okay, so this will be the most important parts of the examination.